Greetings, everyone. My name is Charles Kovac, the Not Safe for Work presidential candidate campaigning for a more direct democracy. And in this video, I'm going to be reading a piece of legislation from my home state of New Jersey. This is it says the first reprint, this is what I found, of from the New Jersey Senate, number 2173 of the 218th legislature. This was introduced in March 5th of 2008, or sorry, 2018, 2018, sponsored by Senator Loretta Weinberg and Senator Joseph F. Vitale. I think that's how you pronounce his last name. And this is actually my second making of the video, because getting most of the way reading the video the first time, I realized I made a very bad mistake, and yeah, I'm just not going to go into it. But I'll explain as I go along. So, this has apparently passed the legislation of New Jersey and is waiting to be signed by the governor. And if you want to go look it up right now so you can read along, because it is going to be a little confusing even for me as reading it, because there are parts of removing text, placing in text, and then removing text that was supposed to be placed in, and that's why my last video went completely to shit. So, once again, it's 2173 in the state of New Jersey. Okay, synopsis. Clarifies statutory exemptions from mandatory immunization requirements for child care center and school attendants. Current version of text, as reported by the Senate Health and Human Services and Senior Citizens Committee on December 12, 2019, with amendments. Okay, an act concerning exemptions from mandatory immunization requirements and amending various parts of the statutory law. Being enacted by the Senate and General Assembly of the State of New Jersey, Section 6 of PL 1974, Charlie 150, Charlie 26, 1 Alpha TAC 9.1, that's a mouthful, is amended as follows. So what I'm about to read is all the changes that are going to be put into this legislation. 6 Alpha, provisions in the state sanitary code and implementation of PL 1947, Charlie 177, Charlie 26, 1 Alpha TAC 1, et sequitur. God, after almost an hour of reading and talking, my mouth is going to shit. Or provisions otherwise set forth in statute or regulation which require the immunization of children in a public or private licensed child care center, or students in a public or private preschool program, elementary or secondary school, or institution of higher education, shall provide an exemption from such mandatory immunization based upon a written statement submitted using the standard form as shall be prescribed by the Commissioner of Health. So if you're reading along, if you look down at the footnote here, which is something that I didn't do first time, so everything in brackets is going to be omitted, everything underlined is the new stuff, and everything that's just regular is there, and the superscripts indicate stuff that was recently added. So that's what's making this a little difficult to read. So, statement submitted using standard form as shall be prescribed by the Commissioner of Health to the public or private child care center, preschool program, elementary or secondary school, or institution of higher education is applicable by a licensed physician, doctor of osteopathy, or advanced practice nurse that includes 1. The professional's full name and address, and the national provider information identifier of the professional or the professional's collaborating physician, and 2. A statement that the vaccine is medically contraindicated for a specific period of time, and the reasons for the medical contraindication, which shall be valid medical reasons that are consistent with the guideline issued by the Advisory Committee on Immunization Practices in the Federal Centers for Disease Prevention. A medical exemption submitted pursuant to this subsection may be reviewed and subject to approval by the physician employed employed by or consulting for the local or county board of health. Medical exemption approved pursuant to this subsection shall exempt the child or student as applicable from the vaccination for the stated period of time. Okay, so that's basically saying if a doctor says that there's a problem with you getting the vaccination, then you're exempt. And they were going to put in stuff, and they're not. Okay, county and local boards of health shall have the authority to audit medical exemptions approved pursuant to this subsection, subject to the provisions of subsection 1 of section 4 of PL 2004, Charlie 138, Charlie 264, TAC 134. The professional issuing the student the statement shall additionally enter the statement into the child or student's records into the New Jersey Immunization Information System established pursuant to the PL 2004, Charlie 138, Charlie 264, TAC 131, sequitur. Okay, so if you're reading along with this, you'll notice that a huge chunk has been taken out, and the chunk that was going to be put in but then got taken out. So there's a couple things that were going to be put in that were going to be taken out. So what was going to be put in was exemption, in essence, exemption for religious liberty. But that religious liberty didn't cover political, social views. If you had concerns for the vaccine, like concerns for the safety and the efficacy of the vaccine, and the risks and benefits to their health. So I'll keep reading this part, and then I'm going to go off to do my rant again that I did in the video that you can't see now. Okay, a public or private child care center, preschool program, elementary or secondary school, or institution of higher education shall not exempt a child or student as applicable from a mandatory immunization unless a child or student or the child's or student's parent or guardian, if the child or student is a minor, complies with all of the applicable requirements set forth in subsection alpha of this section. So that would have been subsection Bravo. So subsection Charlie, the Commissioner of Health, pursuant to the Administrative Procedure Act, PL 1968, Charlie 410, Charlie 5214 Bravo TAC 1, et sequitur, shall adopt rules and regulations to effectuate the purposes of this section, except that, notwithstanding any provision of PL 1968, Charlie 410, Charlie 5214 Bravo TAC 1, et sequitur, to the contrary, the Commissioner may adopt immediately upon filing the Office of Administrative Law such regulations as the Commissioner deems necessary to implement the provisions of this section, which shall be effected for a period not to exceed 6 months and may thereafter be amended, adopted, or readopted by the Commissioner in accordance with the requirements of PL 1968, Charlie 410, Charlie 5214 Bravo TAC 1, et sequitur. So that was all the amendments that were going to in that one legislation. Now let me go into my spiel. So, vaccines. The way vaccines work and what they are. So you have a virus or a bacteria. So the two ways that vaccines are created are to use either a inert or dead version of that virus or bacteria injected into the body, or to use some compound or other organism that can destroy that whatever virus or bacteria you are vaccinating against. So the world is a big place, and you can't completely eliminate something as small as a microorganism. There will always be places to hide and replicate. That's what cells do, they replicate. Now, when microorganisms replicate, You have a chance for a change in the genetics, and that's what evolution is. So when that happens, now that organism might wind up coming back because now it's immune to whatever you used against it in the first place. So such a thing like MRSA, methicillin-resistant Staphylococcus aureus. So so the immunization also has this chance to create the superbugs, right? As people like to call them. Now, what happens if you don't get immunized? Okay, well, you then run the risk of contracting that virus or bacteria. So if that virus or bacteria infects a person, well, now it has even more opportunity than it did before to multiply. And again, with each multiplication, you have a potential for evolution to happen where it becomes resistant or immune to whatever countermeasures that people use. Statistically, this is more likely to happen if people are not vaccinated. So people have their beliefs, okay? Some people don't believe in vaccinations, and there's other things which I'll get to in a little bit. And for them, the question is autonomy. Are you not in charge of your own body? Do you not have the right to determine what goes on with your own body? Well, the flip side of that is does a person not have the right to protect themselves? Because, I mean, what are we going to do? Have people that are vaccinated and not vaccinated quarantine from one another? I mean, if I go, think of it like this, right? You and I are neighbors, and I buy fire extinguishers and a sprinkler system, and you decide to light your house on fire. What's going to happen to my house? So it's not so easy to just say that it's all about autonomy, because no one is an island. That's something I keep saying. Now, let's talk about the more concerning thing when it comes to vaccines, and that is specifically things like preservatives that are used in these vaccines, as well as whatever they might be using to make the viruses and bacteria inert when they're using that route. So when you inject an inert virus or bacteria, the virus or the human body can come up with can design a defense against it. That's how you get immunized, and then you don't have to worry about it anymore because your body already has the antibodies against the virus. But if a live virus gets in, then it can quickly override your body before your body can produce any antibodies, or maybe it attacks your immune system, therefore preventing it from making any antibodies. So, which is what HIV does. Now, when we use things to make these inert, well, there's the question of how much does that affect people, right? Or how much does it affect the actual health of the people? Because you're using something to kill a living organism. It might have an effect on the human body as well. I mean, that's something I gotta think about. But of course, I wouldn't expect this information to come out since most of the vaccines are developed by private institutions. And like I say, when it comes to certain things, I'd rather have the government than a corporation be behind something, because then I only have to go after one person instead of two. That's another conversation. So yeah, I mean, especially when you look at the chemical compound thimerosal, I mean, whoever thought it would be a good idea to inject this compound, a compound that has a mercury atom on the end of a long hydrocarbon chain, whoever thought that would be a good idea to inject that into the human body, needs some serious, I don't know what the fuck, because if you have, I mean, it doesn't take rocket science to know that if you have an atom at the end of a chain of other atoms, that's probably going to be one of the first atoms to go. And that's so when people have these concerns like autism and whatnot, they're justified. These preservatives that are used are not really much better for your health than the damn viruses in the first place. I mean, what do we got to do? Produce the vaccines on the spot so we don't have to use any preservatives? So, but then there's the question of, okay, well, even in those cases, would you rather have the effects of the virus? Would you rather take your chances with the virus, or would you rather take your chances with the effects of the preservatives and the vaccines? Ultimately, the future is not a written thing. All we can really do is take a guess at what's going to happen. Because nobody knows. You don't know. I don't know. And that makes us all feel uncomfortable. And that's okay. But the reality is, in making a decision like vaccines, you're either choosing statistics or feelings, no matter which way you decide on the subject. Me personally, I'd just flip a fucking coin. I mean, what else can I do? I don't know any better than anybody else, except I know the statistics. I mean, now, if it was like 90% chance that, or 95% chance that it's not going to hurt people and, you know, it's actually going to help people, then I'd be a little more inclined to say, yeah, fucking take the goddamn vaccine. But we know that that's not the case with all these health concerns that have been coming up over the years from vaccines. And especially if you look at, like I said, you just look at the structure of what's being used. So this is just one of those situations where there is no right answer. And I'm not going to sit here and tout one side or another just because you can't really say. So, I mean, I could say that I want people to get a vaccine strictly on my own personal bias that I've been vaccinated. But, you know, who am I to judge the lives of other people? Or who am I to make decisions for other people? This is, the whole question on vaccination is really something that we, as a people, and this is one of those reasons why I'm doing this whole thing, because I want a more direct democracy, so that we as a people can come together and say, okay, here's all the issues, here's how we feel, here's how we're going to decide how to do it, rather than, you know, just some people that we hope to make the right decisions for us. So, there you go. So let's continue reading on with this legislation. Okay. So Section 2. Section 4 of PL 2002, Charlie 58, Charlie 18 Alpha, 61 Delta TAC 10 is amended to read as follows. 4. A student shall not be required to receive a vaccination pursuant to Section 2 or 3 of what's it called? PL let's see. Okay. So whatever previous section that was, so P is, because there was stuff in here that talked about medical reasons and religious exemption, religious objection, but that's all getting cut out from what's going to be put in. So it just says a student shall not be required to receive a vaccination pursuant to Section 2 or 3 of PL 2002, Charlie 58, Charlie 18 Alpha 61 Delta TAC 9, or Charlie 18 Alpha 40 TAC 21.1 if the student qualifies for an exemption as provided in Section 6 of PL 1974, Charlie 50, Charlie 26, 1 Alpha TAC 9.1, which is that the one we previously read? Yes. So that's the part we previously read where it's referring to the medical conditions. Section 3 of PL 2003, Charlie 284, Charlie 18 Alpha 62 TAC 15.2 is amended to read as follows. 3 Alpha, students shall not be required to receive a vaccination pursuant to Section Alpha of Section 2 of, and there was a whole bunch of stuff, which is the same stuff that got removed. PL 2003, Charlie 284, Charlie 18 Alpha 62 TAC 15.1 if the student qualifies for an exemption as provided in the first stuff we read. Bravo, in the event of actual or threatened outbreak of meningitis at a public or private institution of higher education in this state, the institution may exclude from attendance a student who has been exempted from the vaccination requirement of this act pursuant to subsection alpha of this section as determined by the Commissioner of Health. Okay. I mean, again, it's the concerns of, you know, the superbug. It's statistics. Okay, so that was that amendment. 4. Section 4 of PL 2004, Charlie 138, Charlie 26, 4 TAC 134 is amended to read as follows. And as usual, I'm not going to be going through and reading all these, going back to these legislations and whatnot. Okay, 4 Alpha, there is established a statewide automated electronic immunization registry to be designed as a New Jersey immunization information system in the Department of Health. The registry shall be designed to serve as a single repository of immunization records and to aid, coordinate, and help promote effective and cost-efficient disease screening, prevention, and control efforts in the state. Bravo, a newborn infant in the state who is born on or after January 1st, 1998 shall be enrolled in the state registry immediately following birth, unless the parent or legal guardian of that infant provides a written request not to participate in the registry. So granted, the person would be 21 right now, but you still have people that are still adults and under legal guardianship for whatever health reasons. A child born prior to January 1st may be enrolled in the registry at the parent or legal guardian's written request. Charlie, I mean that's the only reason why I can think they're using 1998. Charlie, access to the information in the registry shall be limited to healthcare providers, schools, colleges, licensed child care centers, and public agencies and private organizations as determined by the regulation of the Commissioner, which is kind of like, which private agencies and, you know, which schools. I mean, you have private schools, well, I mean, places claiming to be schools that, yeah, I'm not going to get into that tangent. A registrant or the registrant's parent, legal guardian, if the registrant is a minor, shall have access to the registrant's immunization and other preventive health screening information in the registry. Delta, the information. Oh wait, I forgot about the. So all that stuff there, the 1998, is because this stuff existed beforehand. So even Bravo of the last thing was stuff that exists. I keep forgetting the underlined stuff is the new stuff that's getting put in. But I'm just going to read it anyways because it's here spelled out for me, so why the fuck not? So all the things I've read of the amendment is stuff that's already there, and we'll get to the stuff that's going to get added in. The information contained in the registry shall be used for purposes including but not limited to 1. To help to ensure registrants receive all recommended immunizations in a timely manner by providing access to the registrant's immunization records. 2. To help improve immunization rates by providing notice of registrants due or overdue or upcoming immunizations. And 3. To help control communicable diseases by assisting in the identification of persons who require immediate immunization in the event of a vaccine preventable disease outbreak. So, okay. Yeah, I forgot that part. So, and then the previous two, not the, I know I'm fucking jumping around here, but the previous two, uh, what's it called, amendments were to take out authorizations for, or take out exemptions for religious beliefs and medical reasons. But it does add medical reasons into the first text that it's amending. So that's important to keep an eye on, to take note of. All right, going back to where we are. The authentic immunization, other preventive health. This is all still stuff that's just not changing. It's in the statute already, and I'm just reading it because it's here. The authentic immunization for other preventive health screening record of a child, which shall consist of a paper or electronic copy of the registry entry that is true and accurate representation of the information contained therein, obtained from the registry, shall be accepted as valid information, and preventive health screening record of the registrant for the purpose of meeting immunization and preventive health screening documentation requirements for admission to school, college, or licensed child care center. Foxtrot, a healthcare provider shall not discriminate in any way against a person solely because the person elects not to participate in the registry. Okay, now this part is going to be taken out by this legislation. So what was there before that's going to be taken out is golf. An authorized user granted access as provided in subsection Charlie, which was the schools and so forth, of this section shall only access information in the registry on a specific patient or client who is presently receiving services, is under the user's care, or is within the applicable government health authority's jurisdiction. So what they're taking out is that the information you're allowed to look at is only a specific person that you're dealing with. So I'm guessing it's saying, oh, well, this is I guess they're just going to say, oh, the whole thing's publicly visible now, or whatever. Well, not publicly, but visible to whatever. Which, I don't know why. An agency, hotel, an agency, organization, or other entity authorized to access information in the registry shall not use any report made by a healthcare provider pursuant to this act in any punitive manner against the provider. Okay, what about against the registrant? Okay, so now this is text that's going to be inserted. A record of exemption from mandatory immunization on the grounds of medical contraindication shall be included within the registry along with supporting documentation. Within 1 year after the effective date of whatever this bill is going to be in the statute, the registry shall be updated with the capability to allow for the inclusion in the registry of relevant forms provided by the Department of Health, including the form or equivalent information included in the form prescribed by the Commissioner of Health, upon which a healthcare professional provides the reasons for issuance of a medical exemption to a mandatory immunization, including the name, address, and national provider identifier of the healthcare professional responsible for completing the prescribed form. Within 1 year after the effective date of whatever this bill is going to be marked as, the registry shall be updated with the capability to allow for the generation of a printable report on the information placed in the registry as required pursuant to this subsection. Okay, and then what was previously India is going to be Juliet. The Commissioner, in consultation with the public, so this is stuff that's already there. They're not changing this text, they're just changing the designation from subsection India to subsection Juliet. The Commissioner, in consultation with the Public Health Council, shall adopt rules and regulations pursuant to the Administrative Procedure Act, which is PL 1968, Charlie 410, Charlie 52, 14 Bravo 1, Attack 1, Exequatur, to effectuate the purposes of this Act, including but not limited to 1. The establishment and maintenance of the registry, 2. The methods for submitting the contents of reports of immunizations to the registry, for which purpose the Commissioner shall provide, to the maximum extent practicable, speaking is hard, for reporting options to facilitate compliance with the requirements for subsection Bravo of this section. Subsection Bravo, once again, was the newborn infant automatically being registered. 3. Procedures for the birth hospital of a newborn infant or a healthcare provider as applicable to inform the parent or legal guardian of a newborn infant or minor of the purpose of the registry and its potential uses by parties having authorized access to the registry information and the content of their information. Make sure people are aware. 4. Procedures for a registrant or registrant's parent or legal guardian of the registrant is minor to review, correct the information contained in the registry. 5. Procedures for the parent or legal guardian of a newborn, infant, or minor, or a person over 18 years of age to request to not participate in the registry at any time and to remove or inactivate information from the registry. 6. Limits on and the methods of access to the registry by those authorized pursuant to subsection Charlie of this section. 7. Procedures for health issuers to obtain immunization information from the registry concerning only their covered persons, as well as the summary statistics, which information or statistics shall not be used or disclosed for any other purpose than to Alpha, provide improved patient care. Bravo, provide quality assurance to employers purchasing group coverage and to healthcare providers. Charlie, improve outreach and education efforts with respect to their covered persons and healthcare providers. And Delta, monitor improve quality of care standards as developed by professional organizations, accreditation agencies, and government agencies in collaboration with the department. And 8. Procedures for the department to disseminate statistical information and supporting commentary. Okay. Okay, so that was all the amendment to that previous section, and we just got one more, which is a couple pages. Section 5 of PL 1983, Charlie 492, Charlie 30, 5 Bravo Attack 5 is amended to read as follows. 5. Alpha, the department shall have responsibility and authority to license and inspect child care centers. The commissioner shall promulgate rules and regulations for the operation and maintenance of child care centers, which shall prescribe standards governing the safety and adequacy of the physical plant or facilities, the education, health, safety, and general well-being and physical and intellectual development of the children, the quality and quantity of food served, the number of staff, and the qualifications of each staff member, the implementation of a developmentally appropriate program, the maintenance and confidentiality of records. So far, by the way, so far this is nothing that's being modified. It's just there already. And the furnishing of required information, the transportation of children, and the administration of the centers. This is all just so far just regulating how these things take place, right? Just like you have like workplace safety and all that kind of stuff. The Commissioner shall also promulgate rules and regulations for license application, issuance, renewal, expiration, denial, suspension, and revocation. In developing, revising, or amending such rules and regulations, the Commissioner shall consult with the Child Care Advisory Council created pursuant to Section 14 of PL 1983, Charlie 492, Charlie 30, 5 Bravo, TAC 14, and with other appropriate administrative officers and agencies, including Department of Health and Senior Services, Education, Labor, Community Affairs, and the Division of Motor Vehicles, giving due weight to the recommendation. I don't know why the Division of Motor Vehicles is in there, but it is. The rules and regulations promulgated pursuant to this act shall be adopted and amended according with the Administrative Procedure Act, blah, 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 blah. Bravo. The department shall conduct... Okay, well, hold on. Alright, so I'm not going to read any more of this, because other than that, they're not really doing anything in here, any real amending, other than just I'll just read it. So in Charlie, it says, any rule or regulation involving physical examination, immunization, or medical treatment, it gets changed to read, any rule or regulation involving physical examination or medical treatment other than immunization shall include an appropriate exemption for any child whose parent or parents object to on the ground that conflicts with the tenets and practice of a recognized church or religious denomination of which the parent or child is an adherent or member. So this is still allowing for... Oh no. So medical treatment other than it. So that's taking out religious exemption for immunization, because they took out immunization and said other than immunization. Okay, so that's really the only what's it called? That's really the only modification that's going on in that text. And this act, and the end thing is, this act shall take effect 180 days after the date of this enactment. Okay, so what do I think about this bill? Well, again, it's hard to say, because the whole conversation about I can't just say one way or another. I don't like the fact that I don't like the saying, hey, I know you don't want this, but you got to do it anyway. Especially when there's really serious concerns involving vaccines. I could be more for it if it required vaccination, but under the condition where people's legitimate concerns could be addressed. And what I mean by that is not making sure certain preservatives aren't used. I mean, if that was the case, well, I mean, I guess really that wouldn't need to be in legislation, but it's hard for me to be for it, it's hard for me to be against it. I'm really just going to flip a coin and say, okay, that's my position on it. Because all the arguments are legitimate. So, yeah, I mean, realistically, there's nothing more I can say about that. I can say about this legislation and the whole vaccination question. So I'm going to leave it there. Hopefully this has enlightened you somehow, and hopefully you had fun reading along with me, because no, you didn't. But anyways, once again, my name is Charles Kovach, and I thank you for your time.